Hi everyone, these are the important questions. Do I need to go for chemotherapy? How many sessions of chemotherapy do I need? What about immunotherapy? What about surgery? What about CT scans? Well, join us on our Simply Healed program every Thursday nights at 7:30 p.m. Singapore, Hong Kong and Philippine time. Our sessions are interactive, featuring a live Q&A with experts and doctors who will answer your questions in real time. You can type in your questions and get immediate, personalized responses. This is your chance to take control of your health. So take advantage of this informative and supportive experience. Visit our Facebook page and message us on Messenger to find out more. See you there this Thursday.
One reason why I recommended initially PPARS is because it can induce lung cancer cell death. The main reason why I tried PPARS liquid, and it did well for the patient. It helped with the tumors. The enlarged abdominopelvic lymph nodes were not detected. This was gone. So that was something that I was actually quite surprised. A 12-centimeter tumor disappearing.
Everybody turn to your neighbor and say, do more. Right? Don't just think there is no one product that will cure you of cancer. Okay, that is like it's like a scammer trying to sell you something. All right, it is a comprehensive approach. When you need surgery, do the surgery. But prepare for the surgery so that you recover well, right? And then if you need to do chemotherapy, radiation therapy, do it. So this is where PPARS really comes in. It's a gene activator, so it's a signaling pathway. It switches on your pathways, your systems. Then the other nourishment that you take will be properly used. Is it easy to understand now?
Now let's not keep you waiting. We are now officially opening the AMA or Ask Me Anything portion.
So she has to take maybe just the capsule or the powder just to regulate blood sugar. And then undergo the surgery, and after the surgery, to aid in wound healing also and for recovery, she can continue the capsule.
I can safely say this, all LJ products are great. But if you have acute illnesses like cancer, then we are a world of a difference. Because if you want chlorella, take chlorella. Diba? If you want spirulina, take spirulina. When you take Simply Nature PPARS, you're taking our microalgae for its PPAR agonist.
We are always with you from start to finish.
Yung sister ko had the symptoms of diabetes. Siguro 10 years na. Madalas siyang umiihi, tapos laging pagod, pumayat, mataas ang BP. Tapos siyempre, mga non-healing wound.
Yung sa paa po ni ma'am, paano po yun nag-start?
Okay. Kasi ganito yun eh. Yung first na hospital niya, not because of diabetes. Ang una niya, pneumonia. Ayan. Doon nalaman na may diabetes din siya, by accident. Right foot niya, may para siyang matang isda lang. Maliit na itim lang. Tapos napapaligiran lang siya ng parang dilaw na kulay na dilaw. Ring sa sugat na yun sa center. Tapos tinanong ko, bakit? Hindi niya daw alam anong reason. So sigurado ko dahil nga may background ako sa medical, siguro dahil yun ay lumala na yung taas ng sugar niya, hindi niya na monitor, hindi niya nabibigyan ng gamot, nagkaroon siguro siya ng komplikasyon. Yung nerve sa paa na damage na. So, hindi niya na nararamdaman na may natapakan pala siya. So, probably, yun siguro yung nangyari. May natapakan siya, nasugat yung paa niya, maliit lang, tapos hindi niya naramdaman. Lumala. So, nagkaroon siya ng lagnat on and off, nakahiga lang siya. So, sabi ko sa kanya, so anong plano mo? Sabi ko, pa-check na natin yan. So, pina-check namin as OPD. Chinek, binigyan, niresetahan ng gamot. Tapos, tinignan yung sugat, binusbos. Pero kapiranggot lang ang tinignan. Tapos, in-advise na lang kami, linis, at 7 days na gamutan ng antibiotic. After ng 7 days, lumala lalo. Yung pinaka-pamamaga niya, lumaki lalo. So, sabi ko, ay, na-infect na to. Nilala ko sa emergency room. Ayun, doon nalaman lahat. Mababa pala hemoglobin, mataas masyado yung sugar, yung diabetes niya, talagang marami ng komplikasyon.
Ano po yung plans ng doktor niya?
Na-refer siya sa ortho. Ang plano sa kanya ay putulin. VKA or the below the knee amputation. Hesitant din kami pumirma ng consent. Then later on, ni-refer naman siya sa plastic surgeon. Nagsabi naman sa amin na maganda pa circulation. Might as well na tulungan na lang natin yung paa, linisin, wound dressing for twice a day, then debridement as needed, religiously. So, yun ginawa namin. Twice a day kami naglilinis, tulungan kami ng husband niya. Hanggang ang nangyari, gumanda, pero andun pa rin yung plan na putulin. Hanggang makita na gumaganda na, ayun, hindi na naulit yung plan nila na maputol yung paa.
Kasabay po ba nun may mga tinitake pa siyang gamot?
Bukod doon sa antibiotics, bukod sa mga gamot na binigay ng doktor sa ospital, may tinake din siya na alternative medicine, yung PPARS. May kamahalan. So, sinugal ko para, kasi kailangan kung di mo isusugal yun, baka maputulan talaga. Kasi kahit naglilinis kami ng paa, tapos nagdidibri, pero parang slow yung healing process niya. So, I tried na painumin siya at 10 tablets at AM and 10 at lunch and then 10 at the evening. And the soft gel, twice a day also. So, religiously binibigay ko yun sa kanya. Ang dati kasi dahil nag-peak yung WBC niya, medyo nag-septic siya. Sa mga nakakaalam, sabihin yung infection kumalat na sa buong katawan. Kaya nagkaroon ng problema yung kaisipan na nawala sa wisyo. Dramatically, yun yung maganda doon. Dramatically, after 1 to 2 days, parang nakita ko siya ng improvement. Doon, nakita namin na sa help ng antibiotic and together with PPARS, sabi ko, maganda yung kinalabasan. So, why not continue? Hanggang nakita ko rin na gumaganda yung healing process. Tapos yung WBC, nag-dramatically from 46. Imagine, 46, dramatically bumaba siya ng 39, 33, 27, 19, 15, and then 11, 9, 7. So, nakikita mo talaga yung changes na nagawa ng gamot na yun. So, yung support ng family ay mahalaga sa recover ng pasyente. So, una, yun yung talaga nakikita ko, yung support system. Then secondly, syempre, with the help of the advanced technology, like yung mga ini-introduce ng mga gamot, hindi ko pwedeng alisin yun sa scene, sa scenario. So ako kasi, dahil nga nasa medical field ako, medyo alam ko yung mga ganyang mga alternative medicine and evidence-based ako. So sa PPARS, sabi ko nga, maganda yung result. Ito walang harong biro to. It's not joke. Yung man ako binayaran So it's no joke. Talagang maganda yung yung nangyari sa kapatid ko, lalo na yung wound healing. Yun yung nakikita ko, yung wound healing talaga. Nag-granulate siya, gumanda yung circulation, nabuo ng laman, okay? Nagkalaman yung mga paa niya na dating wala. Makikita niyo naman sa picture, di ba? dating wala, nagkaroon ng laman. So, na-prevent natin yung pagputol. I can say na effective. Okay, effective yung PPARS.
Ano yung maa-advise nyo sa mga patients na same case sa sister ninyo?
Okay. So, I advise them to try. Then, kagaya ko, gusto ko may ebidensya na experience ng on hand ng ate ko. So, ganun din yung papayo ko. Try to experience yung healing, try to take the medicine religiously ha. Despite medyo may konting kamahalan, but then kung titingnan mo naman yung long term na gamutan, mas mahal yun. Tsaka hospitalization. At yung siyempre, yung recovery. Yun yung maganda doon eh. Yung recovery, mapabilis. So, try ninyo. Hello, I'm Joel Elcano. My sister, diabetic since way back 10 years up to now. Because of Simply Nature, hindi niya na kailangan mag-amputate. Yung recovery niya, yung unti-unti nagkaroon ng maganda, nagkalaman yung kanyang mga paa. Still recovering, yet nakikita ko yung magandang bunga. And that is because of Simply Nature, PPARS. And I trust Simply Nature.
Assalamualaikum warahmatullahi wabarakatuh. Bismillahirrahmanirrahim. Ako si Haji Norma Yusuf, taga Zamboanga City. Pero dito na ako nakatira sa Maynila. 13 pieces na bukol, pero yung mga iba maliit siya. Pero yung itong isa malaki siya, parang umabot na ata ng 3. Kaya nga ito sabi ng doktor, kailangan tanggalin na. May kaibigan ako, i-try ko daw itong yung PPARS. Pangalawang gabi, naramdaman ako parang iba. Yung parang may langgam na parang gumagalaw ganyan hanggang dito, hanggang sa talampakan, ganon. Pangatlong araw ko. Parang kung sumakit yung dito ko, parang gusto ko talaga. Pag ko ganyan sa CR, yun parang lumabas talaga na ganyan, napakarami talaga. Siguro sunod-sunod yun, 3 araw, ganun. Tapos sabi ko, pagtapos yung dito ko, minsan yung parang, ganun-ganun ako. Parang masikip dito, parang minsan sumasakit dito ko, ganyan. Yung na ako dito, umabot na ng mga 5 days, ganyan. Parang nawala yung sakit dito, nawala siya. Parang hindi na ako ganun-ganon. Pag nagsalita ako, parang tuloy-tuloy na, wala na akong halos maramdaman. Kaya siguro, hindi ako, sabi ko, parang ayaw ko magpa-opera. Siguro, mayroon talagang gamot para dito. Binigay ng God. Ngayon, hanggang ngayon, parang maganda ang maganda ang pakiramdam ko. Yung high blood ko, pag parang magandang tinanggal ko na yung sa cholesterol ko, hindi na ako, pero yung sa cholesterol ko, pag tinatanggal ko yon, parang hindi, mga 2 araw, parang masama ang pakiramdam ko. Pero ito, 14 days na, ngayon 14 days na, basta 2 weeks na, hindi ako uminom ng subastatin, wala akong nararamdaman na parang maganda ang Kaya yun, ngayon bumili pa ako ulit ng tablet. Oo. Kasi sabi ko para para lumakas talaga sa akin ng Kasi nararamdaman ko talaga na maganda. Haji Norma Yusuf, ay bukol ako dito sa liig ko, 13 piraso. Umabot na ng 3 cm. Take ako ng PPARS 2 times, morning at saka gabi. Pag numulok ako, hindi ko na siya mararamdaman. At saka, kinakapa ko siya. Parang nawawala, parang wala na. Hindi ko mahawakan. Hindi katulad ng dati. Salamat, Simply Nature.
everyone, I'm Sheila and welcome to another enlightening episode of Simply Healed webinar. This program is brought to you by the collaborative efforts of Simply Nature International and Simply Healed Medical Group. We are an international distributor of food supplements derived from unique strain of microalgae known as PPARS, which has been tried, tested, and certified proven to support not only cancer treatment, but also enhance general health and reverse metabolic syndromes like hypertension, diabetes, and high cholesterol. Just to recap on our last week's topic, last episode we discussed how it feels to be cancer-free. Lots of questions were asked and most importantly, answered by our experts. In this week, discover how cancer patients and metabolic illness patients can benefit from using PPARS because tonight's interesting topic is entitled Cancer Diagnosis, Take Action Immediately. Receiving a cancer diagnosis can be overwhelming, but the most powerful step you can take is to act quickly. The sooner you take charge of your health, the more options you have for treatment and recovery. Tonight, we'll explore how timely decisions and proactive care can make all the difference in your journey. It's crucial to understand that early action is key in improving outcomes and enhancing quality of life. We'll provide insights on how you will support and navigate the medical system, find your support you need, and make informed choices that align with your personal goals. Your health is in your hands, and by acting immediately, you can empower yourself to face cancer with strength and determination. Let's embark this journey together, armed with knowledge, and take decisive steps towards the brighter future. So, without further ado, let's dive right in. Please note that we will be having an AMA or Ask Me Anything portion later on, so please feel free to drop your questions in the comment section. Leading our discussion for tonight are distinguished health experts. First, I'd like to introduce a successful entrepreneur and seasoned international speaker on a wide range of topics from personal success to healthcare. He is the CEO and director. Now, on to our next health expert. It is an honor to present our esteemed speaker, Dr. Jansen Kalalan, a distinguished graduate of St. Luke's College of Medicine. Dr. Kalalan is a diplomate of International Board of Lifestyle Medicine and the Philippine College of Lifestyle Medicine. Currently serving as a consultant at renowned institutions, including Alta Integrative Medicine and Wellness Complex at Perpetual Health Medical Center, Las Piñas, and Tree of Life Wellness Center, Centro Holistico, and Simply Healed Medical Group, where he practices integrative oncology. Please join me in welcoming Dr. Jansen Kalalan. Let's all watch this.
Next, you go to your on-go. Follow up with your on-go, please, okay? Because you need to get treated. So whatever treatment it may be, whether it's surgery, chemo, radiation therapy, immunotherapy, targeted therapy, or natural therapy, okay? So you have to get treated. And don't just focus on one treatment and forgo all the others because all these treatments complement each other, okay? The main goal of these treatments, the combination of these treatments, is to give you the best outcome possible.
Hi everybody, welcome to another episode of Simply Healed. Today's episode is going to be so helpful for patients who've been just diagnosed with cancer. We're going to answer that all-important question, but before that, let me welcome Dr. Jansen. Dr. Jansen, welcome back to another episode of Simply Healed.
Hello, Shyan. Hello, everyone. Happy to be here again.
So tonight we're going to talk about actions to do after diagnosis. So you've been diagnosed with CA. That is a very serious diagnosis. You are probably stressed, feeling very strong emotions, and your family is probably also feeling very strong emotions. At this time, panic should not be the thing that you do. What we always want to share with you on Simply Healed is that there is hope. All right, and if your diagnosis was in the early stages, stage 1 and 2, for many cases of cancer, you are going to get well. So if it's stage 1, for most cases of common cancer, the recovery rate is in the 90 percentiles, which means you are going to get well. So if it's the 3rd and 4th stage, then this tonight's show is very important. You have to know exactly what to do immediately, even before your next appointment with your doctor. So doc, what do we do when we are diagnosed with cancer?
Yeah. So it's very understandable that it can be so overwhelming. No? You don't know what to do, and or there's so much to do that you don't know where to start.
Yes, and sometimes the worst part is your doctor may not have spoken to you a lot.
Yeah, a lot.
They just tell you, I'm going to treat you, don't worry, you have prostate cancer stage 1. And then that's all he says. And he told you not to worry. But you're worried because that's all he said.
Exactly. So sometimes it can be, why is my doctor only told me this? Something's wrong. But I mean.
So tonight we have an AMA Ask Me Anything segment after this. So we are here to answer all your questions that you forgot to ask when your doctor gave you your diagnosis. It could have been just yesterday or some time ago. So tonight, just take the opportunity, stay with us until the end of this segment, and we will move to the live Q&A, and you'll be able to ask all the questions so that you're clear on what to do.
Okay, so what I did was to create a checklist for you. So this is how you should go about, this is how you, in general, this is how you should approach after you get diagnosed with cancer. No? So number 1 is to change your lifestyle immediately.
I like this, Doc, because changing your lifestyle is not dependent on the pharmacy or the doctor or the hospital. It's literally the moment you know you have cancer, this is what you can do for yourself, right? I see here the normal advice of diet, exercise, and positive psychology. I want to say this diet thing, doc, because sometimes, we meet many patients, and many patients actually, I just met with my neighbor a few weeks ago, and she was diagnosed with breast cancer, and she was going for chemotherapy. And her doctor, her oncologist actually told her, well, as long as you're going for the chemotherapy, you can eat anything. And immediately, that was not, she knew in her heart that was not right, because her mother had breast cancer, and her mother watched her diet and changed her diet. So, Doc, I just exchanged Viber messaging with her. So I just want to share with you some good news before you even continue. Her doctor said she could eat anything, right? And I talked to her and said, no, you can't. Why? You got breast cancer because you had the wrong lifestyle. So the lifestyle caused the cancer. Now that you do have cancer, that same lifestyle is going to make the cancer worse. So you got to meet Dr. Jansen. So I arranged for her to meet up with you. And this is what she told me. She's now able to sleep. She had to take sleeping pills while she was on chemotherapy because she couldn't sleep. So I can imagine you have cancer and you can't sleep. How tiring. It's like tiring upon tiring, right? Yes. And then she was not always feeling weak. And then she was confessing to me, now she's eating healthier. And she was also on some protocols like PPARS protocol, and she can sleep.
Wow.
Okay, so that to her is amazing. So she said it made the protocols, the advice, the change in lifestyle, the PPARS protocols made significant impact on her chemotherapy. So there you go. This is something that you can do immediately for yourself, independent of your next hospital appointment or appointment with your doctor. Yeah, Doc, maybe you elaborate a little bit more.
Yes. So now, of course, you just got diagnosed with cancer. So immediately, you do whatever you think is healthy to do. Okay? That's changing your lifestyle. You be proactive. Okay? You don't wait for your doctor to advise. Now, of course, we have to optimize. So this is the time that you follow up with your doctors. Your lifestyle medicine doctor, yours truly, and then your on-go. Okay? Very important that you follow up with those two. Okay, so number 1, on my part, my role is to optimize the food that you're eating so that you will be more guided, it will be more structured. So you know where to source them, you know how to prepare them, and for the more nitty-gritty part, just to guide you on whether or not this product is okay or this product is not okay. Right?
Doc, you're being too modest. Honestly, Doc says that he's there to monitor, to optimize your nutrition. But if you really understand what Dr. Jansen is really doing for you, what your lifestyle medicine doctor is doing for you, is that he is taking care of the rest of your body. So remember, normally people won't have 7 specialists because the medical bills will scare you as much as the cancer.
So I understand. So normally you have an oncologist, and you would ideally want at least a lifestyle medicine doctor or a doctor like Dr. Jansen. Why? Because the oncologist, your onco, is a specialist focusing only on the cancer. He's focusing only on the cancer. But when you fight cancer, you got to make sure your kidney is functioning, your liver is taken care of, so that all the waste material, toxic material that comes from fighting cancer and from, example, chemotherapy, the toxic substances that your body reacts from radiation therapy, all these needs to be displaced by your liver, your kidneys. Your lungs have to stay healthy. Your heart has to stay healthy. Your bone marrow has to stay healthy and not be damaged by the chemotherapy. All these things are important, and no one's looking at it because your onco is really not looking at it. He's very highly trained and is a specialist in treating the cancer. He's not thinking about how to take care of your kidneys, and if that is an issue, he will probably recommend a nephrologist to be part of the team. But like many people who go for cancer treatment, having a team of doctors sometimes is pretty scary. Yeah, it could be confusing as well and sometimes intimidating. So at the very least, have a doctor that supports all the rest of your body, and let the onco focus on the cancer. So that's a very important, very, very important approach to fighting cancer. Yes.
Okay? Now, next, you go to your onco. Follow up with your onco, please, okay? Because you need to get treated. So whatever treatment it may be, whether it's surgery, chemo, radiation therapy, immunotherapy, targeted therapy, or natural therapy, okay? So you have to get treated, and don't just focus on one treatment and forgo all the others, because all these treatments complement each other, okay? The main goal of these treatments, the combination of these treatments, is to give you the best outcome possible, okay? So it's very important to undergo the treatments that are recommended by your onco. And then, what your part is to watch out for the side effects. If you feel the side effects, follow up with your doctors, okay?
How important is managing side effects?
It's very important because sometimes it is the one that determines whether or not you complete the protocol or not. And completion of the protocol sometimes, not sometimes, always determines whether your survival rate is high or low, or whether or not the cancer recurs.
You know, and this is important. So number one, side effects are important to monitor. You know, if you can't eat, you don't have energy. If you don't have energy, cancer is actually a disease, an illness of starvation, because your cancer cells are stealing nutrients from your healthy body. So if you're not eating, that's not good, right? So these side effects are critical. You know, just having a low appetite is not something to ignore when you have cancer.
Yes.
You know, I remember one of our programs, you said, cancer patient, you said, first thing, you eat a lot. I mean, that's a very mundane advice, but it's very critical and important for cancer. But some other more serious side effects could be like your red blood cell count is dropping, your white blood cell count is dropping.
Yeah, because of the chemo and the RT.
And if it gets low enough, you can't continue with your treatment.
The onco will stop the treatment because your body cannot handle it. So we would have to wait further for your body to recuperate enough for you to continue the treatment.
And if you wait too long, the cancer
Sometimes
might mutate.
Sometimes you're back onto square one. So
Yes.
that's
So you don't want to lose momentum when you are fighting cancer. So it's so important to take care of, have a specialist like Dr. Jansen taking care of the side effects of the cancer treatment that you're going through. Down here, you know, you are a lifestyle medicine doctor. So in your protocols, you don't prescribe drugs.
I don't.
So it's kind of, I'm sure some of the viewers are thinking, you don't prescribe drugs, but all you are talking about is chemotherapy, radiation therapy. So why not just natural?
Because sometimes natural treatment, although yes, there are some few cases that natural therapy works, but however, these are these are the minority. Okay, the majority of patients is that doing natural treatment alone won't work. Okay,
And I want
to combine everything.
correct. And I want to say to everyone, if you asked me 5 years ago, I'll be pro-natural. I'll be very, very pro-natural because I have this idea that the treatments, chemotherapy, radiation therapy, do as much harm to me as the cancer itself, right? But today, knowing Dr. Jansen and new developments in our protocols, the PPARS liquid extracts, we are able to manage a majority or the major parts of the side effects of chemotherapy and radiation therapy. So then I look at this radiation and chemotherapy with a different light because I have also seen many people go natural and then they die. They die from cancer, right? Then there are people who went for chemotherapy, the cancer died, but they died from the side effects of chemotherapy. But here it is, you see, if you go natural, you die from cancer. If you go for chemotherapy, you die from the side effects of chemotherapy. But here, what if I can manage the side effects of chemotherapy? Then the cancer dies and you are alive because we can deal with the side effects of chemotherapy. But if you go for natural, if it doesn't work, then you die from the cancer. So when I look at it this way, suddenly my whole view towards treating cancer is also different. And I've also realized, Doc, this last few years with climate change, that affected our food supply. So the quality of the vegetables, everything that you eat, the quality of the air. Now we have crazy temperatures. When it's supposed to be cold, it's hot. So I look at it and I say the natural world is not ideal, especially if you live in a city, having to have work in order to pay for your expensive organic vegetables that you're eating for cancer and medical treatment. And we have many patients have children to look after. So we don't live in an ideal, in a farm world out there with super clean air. Pollution is really bad all over the world, even the air that we breathe. So suddenly I realized, there is a lot of common sense that we don't live in an environment where just going natural will work.
Correct.
Correct.
Then one of the good news is as well is you'd be worried of side effects of chemo. No, majority of my patients are actually worried. I don't want to go for chemotherapy, doc, because of the side effects.
But now they're all happy because their tumor is gone and
yes.
the side effects were not as bad as they thought.
Not as bad because I always give Simply Nature PPARS to manage the side effects. So it's one of my strategies that now you know how. Okay.
Now you know how.
So okay, now you got treated. Now that you are on remission, what do you do next? The fight doesn't stop there, okay? You're still not out of the woods. All right? So now we go to post-treatment care. So for post-treatment care, you continue with your lifestyle change because more often than not, the food that you eat is the one that triggers your cancer coming back. Okay? So that's very important. You have to be consistent. Number 2, continue with the natural treatment. And lastly, we just monitor. Take a look at the imaging, take a look at the tumor markers. Okay? So that's how we approach
treating cancer. This is a checklist. This is what you do after you've been diagnosed cancer. Doc, just yesterday I had a conversation with a patient all the way in the United States. And the patient was very, very happy because this is a wealthy patient, so he had many doctors. But he found that me, not a doctor, a research expert in PPARS, actually gave him a clearer picture of how to fight cancer. Because I went to him and showed him the whole approach to fighting cancer, which is number 1, get yourself strong. And straight away from day 1, the moment you are diagnosed with cancer, we are already preparing you for after the surgery, after the chemotherapy, what to do next. The whole process we don't just stop at the chemotherapy. We look at the whole process all the way to the 5-year mark. So we are thinking, I explained to him, it is so important to take care of your body while you're going for chemotherapy, because if you do that, then your immune system is intact after the surgery and after the chemotherapy, and your chances of getting second bout of cancer is reduced. So even from day 1, we are already reducing your chance of your cancer coming back. Because Doc, when you did that special on cancer recurrence rate, my jaw dropped. Viewers, did you know for ovarian cancer, 85% on average, 85% of people who have ovarian cancer, the cancer will come back. So how can you go in treating ovarian cancer without straight away thinking already about the minimizing the recurrence? And this is why I hope today's program gives you a complete picture. And I can see right now, your questions are pouring in. Maybe what I said is triggering some questions in your mind. So Doc, anything else, or should we move to the AMA?
Yeah, I think we should move to the AMA already. I see a lot of questions coming in as well.
So let's move to our Ask Me Anything segment.
Thank you so much, Dr. Jansen and Sir Shyan Lim, for that wonderful discussion and very encouraging. I'm sure that you have learned so much and has come up with so many questions in mind. Well, good news, we are now in the what we call AMA, or Ask Me Anything portion. But first, before we call on our experts, let's quickly greet our viewers for tonight, starting off with Mr. Rans Dialde, Noemi Veras, Jolly Stevens, Helen Kamunay, hello po, Elena Robles Antonio. Okay, wow, we have a lot of new viewers like Miss Lali Moreno. Welcome, thank you for watching us. Roseli Michon, and we also have we also have Miss Irish, Miss Monette Kamba. We also have Miss Nessie Ocampo. Hi, Miss Nessie, and Miss Achas. There you go. Thank you for joining us. I hope that you'll be learning a lot of interesting knowledge today. Now, at this point, let's not keep you waiting. Okay, I can see questions are coming in. And now to answer the questions in this modern world filled with noise of different opinions, trust the ones from the experts. To answer our questions for tonight, once again, I'd like to call on our lifestyle medicine doctor and integrative oncology specialist, Dr. Jansen and our CEO and PPARS expert fresh from Singapore, Mr. Shyan Lim. Good evening, Dr. Jansen. Good evening, Sir Shyan.
Hello, Sheila. Good evening. Hello, Sir Shyan. Good evening.
Welcome back, Sir Shyan. Welcome. Hi, Sir Dr. Jansen.
Yeah.
Oh, we cannot hear you on our end, Sir Shyan. Okay.
I think he has to reconnect.
Yeah. Perhaps. I guess so. Okay. It's okay. Well, we may proceed, all right, with the first question while Sir Shyan is fixing the technical issue. All right. So for the first question, Dr. Jansen. Second. Okay. The first question is, okay, coming from Ms. Banji, immunotherapy.
Immunotherapy, okay. Immunotherapy is a very broad treatment method, but immunotherapy, these treatment methods uses the immune system of the patient to treat whatever. So for cancer, it uses the immune system to treat the cancer. Okay, so that's what it means, no, immunotherapy. So under immunotherapy, there are a lot of different treatment modalities. Okay, so let's just talk about what we know right now. Okay, so in the conventional oncology side of things, you have checkpoint inhibitor. So that would be your Keytruda or pembrolizumab. Okay, so for our viewers who are undergoing this treatment, that's immunotherapy. Yeah, so what it does is it removes the cloaking device of the cancer. So sometimes the reason why cancer grows is because the immune system cannot detect the cancer. So the cancer evades the immune system. So that's why it grows. So now the job of pembrolizumab is to remove the cloaking device or sort of tag the cancer so that the immune system can now detect the cancer to kill the cancer. So that's the concept behind that drug. Okay. So moving forward, we have cell therapies. So cell therapies would include NK cell therapy, dendritic cell therapy. Yeah, those two. So what it does is we get a sample of the tumor from a patient. Okay. So once we get a sample of the tumor, we also get a sample of the patient's immune cells. So whatever immune cell that is, NK cell, dendritic cell, and then prime the immune system of the cancer. Then once you have the primed immune cells, we give it back to the patient. So once we give back the primed immune cells to the patient, now that the primed immune cells would teach the rest of the immune system of the patient that, hey, this is the enemy, kill the enemy. Yeah. So that's the concept behind cell therapy. Okay. Cell therapy, we can now do that already. It's in existence already. It's in the market. It's being used already clinically. Okay. Now, to the more others, no, more advanced ones. We have cancer vaccines in development right now. So cancer vaccines is not used for prevention. So this is different from the HPV vaccine, the hepatitis B vaccine, because those two vaccines are used for preventing the cancer from happening in the first place. Okay. Now, cancer vaccines is similar to the COVID vaccine, wherein it uses mRNA, okay, to develop, it uses mRNA to feed to the body's biological mechanisms to produce whatever receptor that the tumor is expressing, so that again the immune system would be able to kill it, the immune system would be able to recognize the cancer, the tumor, and eradicate it. So that's in the works. It's in the works, but the technology exists already. Okay, this is just speculation, but if you ask when would we expect it to come out, probably within the next decade. Probably within the next decade. Okay. Now there are others like SOTs. SOT is it uses microRNAs naman. But I won't discuss it further already because it's too technical already. But just know that immunotherapy is an umbrella term. It has a lot of meanings. Okay, so yeah, that's what immunotherapy is.
Still very encouraging. I mean, with how you explained it earlier, it seems like immunotherapy is acting like police inside the body of the patient.
Yeah. It's sort of like equipping the police of the right weapons to kill the enemy properly.
Bad guys, yeah.
So I from what you share, it's good to highlight to everyone that immunotherapy, as Dr. Jansen has mentioned, right? It doesn't kill the cancer cell. It actually helps, like the vaccine, train our own immune system to fight and kill the cancer cell. So I think this is for everyone who wants to do a natural approach to fighting cancer. This is actually the right strategy, right? Last week we talked about this extensively, Dr. Jansen. We made the difference between how chemotherapy treats a cancer patient versus immunotherapy. So this week we're actually, Dr. Jansen, giving us a clearer picture of how that works. And again, this is why when you are fighting cancer, you don't want to just, for those of you who are using chemotherapy, you don't just want to how shall I say, survive or go through your chemotherapy. You want to at the same time strengthen your own immune system. Why? Because especially if you're going to use immunotherapy later after your chemotherapy, you've got to have an intact immune system. And the stronger your own immune system is, the better immunotherapy will work. So here is again another good one, right? Where good insight from Dr. Jansen, which is if you are doing immunotherapy, it doesn't mean that having a healthy lifestyle, taking supplements and integrative protocols like Simply Nature PPARS and what Dr. Jansen can prescribe to you, it also helps with your immunotherapy. Even though you're using cutting edge technology from medical science, even these natural lifestyle and natural supplements like PPARS will also help with the effects of the immunotherapy because it strengthens the immune system, whereas the immunotherapy helps you identify the cancer cells, just like COVID vaccines. Yeah. Thank you, Sheila.
Thank you, thank you. I like that the patient threw that question privately to us, because it's really aligned to the topic that we have, which is taking action immediately once they got diagnosed with cancer. So there. All right. So for the next question coming from Ms. Jolie. All right. Which PPARS is best for thyroid nodules? Is it the tablets or the powder? And also how to take this?
Probably I'll let Sir Shyan answer first, then I'll answer.
Okay,
Yeah.
so definitely as long as there are nodules, right, we will go for the extracts, all right, because the tablets is super nutrition. It does have PPAR agonists, but it's not really at the super therapeutic level, right? So it's more for like if your blood sugar, blood cholesterol is slightly high, if you have eczema, psoriasis, mild ones, I mean, you're not having your outbreak. Yeah, so it's sort of like a maintenance and low level healing level. So anytime you have an abnormal growth like nodules, right, you will go for the extract. So I would say powder. Dr. Jansen?
Yeah. So it's powder. So
It's
far,
powder.
in my experience, what really works well for thyroid nodules is the powder in the liquid, especially
Yeah.
the powder. That's actually the one that most of my patients use. So
Thank you, Dr. Jansen. Thank you, Sir Fan. All right. So that's about thyroid nodules. The next question is coming from Ms. Roselle. The concern is lump on the breast. Which best PPARs should she take?
yeah. So for these, for breast tumors, no, first we have to characterize: is it benign? Is it malignant? Okay, so is it cancer or not? Now, this cancer, I would recommend outright liquid, regardless of the stage, whether stage 1, stage 0, stage 4, it's liquid. Okay. Now, of course, don't just rely on the supplement. No, you have to still undergo the appropriate treatments. So, if it is a solid tumor, if it is cancer, especially if it is resectable, if surgery can still be done, then better to have to undergo the surgery. Okay, because if you look into the different cancer treatments, no, that includes mine. The most, the only treatment that will give you the best increase in survival is surgery. Yeah, it is the most, no. Now, of course, if you do the surgery, then the rest of the necessary adjunctive treatments have to be discussed. You have to decide on that, and that's where a consultation you would have to come in. You have to talk to your doctor about it. Okay, so yeah, that would be my recommendation. Now, what about for benign lumps, benign tumors? So it's not cancer; it's just there. For me, it now depends, no. If for breast tumors which are benign, if it is causing problems like if you have pain, especially during menstruation, if it is increasing in size, you have the option to just monitor, or have it removed. Okay, can you use PPARS for it? Yes, you can. What would I recommend? Powder. Yeah, at least the powder. But if you want to have a more effective protocol, then it will be the liquid. Okay, so yeah, that would be my advice. But for benign tumors, you have the luxury of time to monitor. So there.
Thank you, Dr. Jansen. Sir Sean, thank you as well. All right, so for our next question coming from Miss Carissa, all right, what will happen, or what if the concern is cancer recurrence? What is the best treatment for this, and can PPARs be used alone?
For cancer recurrence, it is now more complex. It's more difficult. PPARs alone, definitely it cannot be used alone. Though PPARs can really improve the immune system quite a lot, and an immune booster would be part of the protocol. Now, for cancer recurrence, there are a lot of factors that we have to consider. Of course, if it is recurrence, you probably would have underwent some sort of treatment already previously. So those have to be considered. If you have the financial capacity, what I would recommend is liquid biopsy. because with liquid biopsy, we would be able to know which natural extract and which chemotherapy or immunotherapy or targeted therapy would work against the cancer. So, right off the bat, the treatment would be personalized. So there would be no experimentation that will occur already because we already know what molecules and natural extracts that would work for you. Okay, so that's the approach that I would take. Now, for patients who are, who won't be able to afford it, then the approach would be empiric. So empiric means it's shotgun approach. Okay, the term is, how should I say, less appropriate, but that's how it is, no? So we give you immune boosters, a lot of immune boosters. We make sure that your body is healthy, considering the lifestyle as well. Now we need cytotoxic agents. So cytotoxic means these agents kill cancer cells directly. So some examples would be high dose intravenous vitamin C, B17, amygdalin or latril. So those are in existence as well. Mistletoe therapy as well. So mistletoe, examples, no? What else? We also need to make sure that we starve the cancer cells of energy. So we know cancer cells love glucose, cholesterol, and glutamine. Glutamine it's an amino acid that is richly found in animal food products. So these things we have to take into consideration, then move forward, and then monitor your response every 3 months. So that's how I do it. Okay. Yeah. So that's how I do it for patients who have recurrences. But it's more than that, no? So we really have to talk it out and personalize the treatment for you.
So I want to add to Dr. Jansen. First thing is a recurrence is always more serious, right? I think this is something as a cancer patient you should know. A recurrence is not the same as having another bout of cancer. Excuse me. What do I mean by that? Just so that the viewers can become clear, right? If you have breast cancer and then later you develop, let's say, colon cancer or stomach cancer, these are two different types of cancer. It's not a recurrence. Am I correct on that, Doc? That's not a recurrence, right? A recurrence is when your breast cancer has come back, and it often doesn't come back in the same place. So just so that I know, I mean, for some of us who only deal with our own cancer, right, we didn't think much about it, but it's something for everyone to understand. So when your breast cancer cells goes to, let's say, metastasize, it moves and spreads to your bone, it's still breast cancer cells. It's not bone cancer cells, right? If it spreads to your liver, it doesn't mean that you have liver cancer. It means that your breast cancer cells spread to the liver. Okay, so why is that an important understanding? Because it means that you have the same cancer you had before. Now, this cancer is not new. It's what escaped and stayed hidden in your body. So this cancer is experienced, it's trained, it's more resistant to whatever treatment you have used in the beginning, especially when we are talking about drugs, right? If you use natural ways to treat that cancer, then its resistance may not be as strong as how shall we say, as drug resistance. The reason being, many natural products actually don't work on the illness, but rather works on the body. So the body is able to adapt, right? Now, however, drugs work, like we talked about last week, drugs work directly on the cancer cell. Your chemotherapy works directly on the cancer cell. So the recurrence cancer is often mutated. So they don't behave the same way anymore. So your previous chemotherapy probably will not work well, or maybe not even work at all. I've had direct experience with that. So it's because my tenant in my apartment in Singapore actually is a researcher for a chemotherapy drug company. So he shared this with me. All right. So as Dr. Jansen says, when you deal with a recurrence, I think your mindset should be you will use all available options, right? You will not go for less. You have to be even more extensive, even more aggressive than when you first treated the cancer the first time around. So second time around is not weaker, it's tougher, it's stronger. So your actions should be more aggressive, more urgent, and you should really not try to look for one solution, right? You should try to look for numerous approaches to treating the cancer. So that's why on our program, although I'm the PPARS expert, right? I also will tell you, taking other options, other protocols like Dr. Jansen mentioned, intravenous vitamin C, one of them. These are approaches, changing your lifestyle definitely so that it works well together. And Dr. Jansen will also recommend or confirm whatever your oncologist would like to try. So what's very interesting, give you some ideas is what Dr. Jansen can really help you with also is, in Singapore, many people with recurrence will resort to novel chemotherapy drugs. That means they will use drugs that are experimental. Why? Because the established drugs don't work anymore because this is a recurrence. So this is where Dr. Jansen, being so into cancer and also cancer drugs like chemotherapy, will be able to do his best to advise you on how to support you through if you ever use experimental chemotherapy drugs, right? So he'll help you, give you advice, give you some insight, and we'll explore together because it's going to be a first-time journey for him also because it's a new chemotherapy drug. Nobody has experience with it, right? But it's good that you can get advice so that you can combine and have the best option. Yeah. Someone asked, someone asked about, Eileen Santos asked two questions. One is ivermectin, and the other one is cannabis oil and black seed oil. I'm not familiar with black seed oil. Yeah.
Yeah. Okay. Let me try to answer, no. Ivermectin, CBD oil, and black seed oil. I don't have any experience with black seed oil. Okay, I'll be honest outright. So I won't answer that. For CBD oil and ivermectin. Okay, so first ivermectin. Ivermectin is an anti-parasitic medication. It's used for deworming. Okay. Now, ivermectin, there are a lot of studies that show that it can help stop cancer cells from dividing. So actually, ivermectin, I also use that. I repurpose it for my cancer patients. Okay. Yeah, the only thing that you have to be careful of ivermectin is it causes photosensitivity. So it means that you will be more sensitive to light. Yeah, so some patients actually have visual hallucinations. So they see some things that the rest of us cannot see. No, just joking. It's not ghosts, but it happens. These happen. No, so ivermectin's side effects usually is the liver. So we usually monitor the liver enzymes. If it goes up, no, then we have to monitor closely. The only time that I will not give ivermectin for a patient who have liver problems is when the liver enzymes is 4 times the upper limit of normal. So example, if the upper limit is 40, let's make it simple. If the upper limit is 10, and if your liver enzyme is 40, then I will not give it to you. Okay, so yeah, so we cannot. So it's just too toxic. How often do I see this? In 10 patients, I only see one. It's really uncommon. But when you Google, that's what you will read. No, it's usually the liver usually suffers. Now, in my experience, yeah, only 1 out of 10 of my patients will develop these problems in the liver. Okay, so that's ivermectin. CBD oil. CBD oil, the role of that in cancer management is for pain management. It's really good for pain management. Now, this is mostly for patients who have bone metastasis. If the tumor is compressing some part of your body that's causing pain, then CBD oil would definitely be of value. However, in the Philippines, it is still illegal. Okay, so if you want CBD oil, go to some other country where it is legal and get treated there. Don't bring it to the Philippines because you will be caught by PDEA. Okay, so that's how about it with CBD oil. But my position on CBD oil is it is very, very promising, and the government really has to find a way on how we can use CBD oil properly and correctly and put in the proper regulations so that people do not abuse it. Okay, so this is very much similar to morphine, the opioids like your fentanyl. No? So these drugs are addicting. They are highly addicting, but government regulations are in place, so people don't abuse it. Right? So same thing with CBD oil. So as far as I know, there are already talks between the medical societies of the Philippines and the government on bringing on not yeah on bringing in the use of CBD oil in the Philippines, or allowing the use of CBD oil in the Philippines. So it's in the works. It's in the works, and hopefully within the next 10 years, I'm praying that it becomes a reality. Okay, because a lot of patients would really benefit. Yeah.
I want to add here to everyone that's watching. I hope today's program is very interesting because I'm sure for our viewers, it's really refreshing, right, to hear a practicing medical doctor like Dr. Jansen talk about CBD, cannabis oil, and because and Dr. Jansen is a conventional medical doctor. He has clinic time in hospital and everything. So I think many times our viewers always ask, how come Onco say don't use supplements? And Dr. Jansen, full medical doctor, is actually sharing on topics like CBD. I just want to let everybody know, Dr. Jansen and I was having coffee last year. I think it was last year, right, Doc? In the morning with one of the most senior cancer specialists in the entire country, and he hits one of the top cancer centers in the Philippines, and he was talking about cannabis oil. Okay, so just to share with you, it's not that every doctor out there is so no with supplements. We have very top doctors in heads of their entire field talking about these things. Okay, so I just want to highlight one thing. As Dr. Johnson said, cannabis is not available legally in Philippines. So although I guess when viewers ask us these questions, I just want to encourage you and say, yes, continue your research, all right, onto these experimental, sorry, I won't say experimental, on these things that are still being, that are actually many times proven, but have not gone through the legal process yet. So it's quite difficult to obtain. So they seem very rare and maybe even exotic as a solution. So while you're looking at this, don't miss sight on proven protocols, right? What is available today that is effective, not that is equally effective, and in some cases may be even more effective than these products that are being, how shall we say, tested and everybody's actually interested about, right? So Dr. Jansen mentions intravenous drips. These are very established already. In Singapore, they're not legal, but here in Philippines, they are legal and they are very effective. I myself have gone for programs, courses where they share the mechanism of action, and I understand how it works. So it's really wonderful. PPARS really works very well. Dr. Jansen mentioned about ivermectin. So all these are available. You can use them right now. So I would suggest that, yes, continue your research on things that are harder to get your hands on, but don't waste time just doing the research. Take action straight away. Use the wonderful protocols that we have today to really treat your cancer. And we have so many successful cases under Dr. Jansen's care, and also under the care of Simply Nature through our other doctors as well. So I'm just saying, continue your research, but don't look at things that are exotic only. There are proven things that are very effective, that's available, and you want to take action again immediately, because cancer is a fight against time. Yeah.
Thank you,
Dr. Jansen say the cannabis is going to be legal in 10 years, but for cancer patients, you don't have 10 years to wait, right? You use what is most effective right now, and some of them are even more effective for specific cancers than cannabis.
Well, thank you, Sir Shyan. Thank you, Dr. Jansen. All right, I just want to say I've seen how Dr. Jansen does his consultations, and he goes in depth really with the medications and supplements that you are taking. So for those who are interested to have a consult with Dr. Jansen, you can just simply type in how to consult. Our caring healthcare specialist will definitely get in touch with you immediately and individually. All right, so for our next question coming from Ms. Elena Antonio, why is solendronic infusion important to cancer patients taking anastrozole?
Okay, very good question. Anastrozole is a hormone therapy medication used for hormone receptor positive breast cancer. So by hormone receptor positive, it means you have estrogen receptor and progesterone receptor positive breast cancer. So for anastrozole, since its role, no, its role is to stop the production of estrogen in your body. That is its role. Now, if you will not produce estrogen, the next problem that you will have would be osteoporosis. So that is where zoledronic acid will come in. So zoledronic acid will help build bones. This is to mitigate the side effect of anastrozole. Okay? So I will repeat. The one of the most important side effects of anastrozole is osteoporosis. With osteoporosis, some patients do develop fractures. I've seen my fair share of patients who have suffered, no, with this. Now, to mitigate, to prevent the fracture from happening, to prevent osteoporosis, you need zoledronic acid infusion. Next question, you did not ask, do we have any substitutes for zoledronic acid? Because one of the side effects of zoledronic acid is generalized body pain. It's painful all over your body. Okay, do we have substitutes for this? Zoledronic acid infusion is also once every month. If say for example you don't have the luxury of going to the doctor's clinic every single month, and you hate needles, who does? Do we have any other options aside from zoledronic acid infusion? Yes. The name of the medication is denosumab. However, denosumab is more expensive than zoledronic acid. It will give you less frequency of administration, but zoledronic the denosumab is a pen. Okay, so you inject yourself with that. Okay, so actually with denosumab, you don't have to go see your doctor to have it injected, unless you're afraid of needles and you need somebody else to inject it for you. Then the clinic would be happy to inject it for you, but you have to come to the clinic. So how often do we inject denosumab? So I've seen oncos recommend once every 6 months, once every month, once every 3 months. Yeah, so that's the frequency. No? So there you have it.
Doc, I'm just curious. For patients who get to be injected with this on a monthly basis, does that mean that the dosing gets to be distributed in minimal, unlike those who are taking it every 6 months?
Not really. It really depends on the patient. How severe? Where is the patient starting at? No, so if the patient already has some degree of osteopenia, so it means that the bone density is less already, but not at the point of osteoporosis. Then more injections would have to be done, especially for those who have osteoporosis already to begin with. For patients who have normal bone density, then less injections would be enough. Okay, so once every 6 months, I think for those who have no osteoporosis at all, I think once every 6 months would be enough. Yeah, but it really depends. So it really depends on the agreement between the patient and the doctor. Now, the best person to talk about this would of course be your oncos, because they are the ones giving the anastrozole. Yeah, but my recommendation would be it should be an agreement between the doctor and the patient. Okay, so how I do it is that if I see that the bone density scan is still normal, then I would just recommend once every 3 to 6 months, depending on the profile of the patient, depending on the age and the lifestyle as well. If we have osteopenia, then I would recommend more frequent injections, so once every 2 to once every 3. No, if you have full-blown osteoporosis already, then once every month should be done. Yeah.
Depends patient per patient.
Yeah.
All right, thank you, Sir Shyan. Thank you, Dr. Jansen. Right, before we go through one question, I'd like to read a comment from YouTube coming from Miss Julie O'Malley. Real nodules after my DNC. There's no nodules found for biopsy. Thank God. Maybe maybe it helps a lot. I'm guessing this is PPARS because she is taking the PPARS spout. Thank you for sharing your experience with us. All right, that's very positive note. Okay, I'd like to read, please bear with me. I'd like to read this question because she efforted in typing all this. So it's coming from Miss Mary Slesser. You've seen her at one of your clinics last December, and you prescribed her to go for ultrasound and take PPARS Plus. She got her ultrasound result March 18, and the impression is this. BI-RADS category 4A, so low suspicion for malignancy, right breast nodule. Recommendation is tissue correlation, no ductal ectasia noted. Both subcutaneous regions are unremarkable. Fat-laden axillary nodes are seen at the right. She had blood extraction as prescribed by one of her doctors, and CA15-3, oh sorry, dash 5, sorry, it keeps coming down.
CA15-3. Yeah.
Yes. But -3 and 14.55. So her doctor advised her to go for lymphatic drainage massage. Could you explain this?
Okay. I will explain this as a general advice. Okay? This is not an advice for you specifically. For me to give you the right advice, you have to go and follow up. Okay? Because I have to review your chart. All right? Now, the patient said that she got her ultrasound result March 18 with a BI-RADS 4A category. So BI-RADS 4A means low suspicion for malignancy. So she had a right breast nodule. All right. So now, what does BI-RADS 4A mean? No? What does low suspicion for malignancy mean? So for breast ultrasound, you have different characteristics of the breast nodule, no, appearing on the ultrasound. So based on the characteristics, they classified it, categorized it according to BI-RADS category. Now, 4A is actually, I should say, it's in limbo. Okay. BI-RADS 4A category, low suspicion for malignancy, but there is a chance that it can be malignant. Okay. So how should we approach this? Be a biopsy. Because a biopsy would be able to tell us if the breast nodule is actually malignant or not. Okay? Now, can we excise the tumor outright? It depends. Now, according to the ultrasound, axillary lymph nodes are not are flat. No, there's no enlarged axillary lymph node, which is a good sign. Okay. However, for us to exactly know if the tumor is malignant, to rule out cancer, no, sentinel lymph node biopsy has to be performed as well. So by sentinel lymph node, this means that this is the first lymph node wherein the breast lymphatic, the breast lymph system drains at. So if there is a metastasis or if there is a spread of the cancer, the sentinel lymph node will be positive. Okay, so you have to check that as well. Can we operate on it, remove the tumor outright without, just remove it? We can. It's actually up to your. It's actually your decision if you would want to have it removed outright. Then at the laboratory they just take a look at it if it is benign or malignant. Okay, so if it is benign or malignant, that is where the treatment. That is where the treatment decision, pathway will. That is when you will decide, no, what kind of treatment you have to undergo. So CA15-3, this is a tumor marker for the breast. It is more specific to the breast. It's 14.55. It's normal. Okay. However, I have seen breast cancer patients with active tumors wherein CA15-3 is normal. Yeah, and the tumor is right there. It can be seen with the naked eye. yeah, it is there. Okay, I've seen such patients. Okay, so me, I won't rely completely on these results. Ultimately, the decision on whether to go for cancer treatment or not, we have to base it on tissue biopsy. So biopsy has to be done, okay, for us to be able to decide which path to take. Okay. Lymphatic drainage massage. This is actually a very good idea to do once in a while because sometimes, um, because of physical inactivity, the lymphatic system inside the breast can get congested. Okay, so if it congests, then your breast won't be able to detoxify properly. It won't be able to remove the wastes properly, and that can manifest as, you know, some abnormalities on ultrasound. So I believe that is why your doctor advised lymphatic drainage massage for you. Okay, so my recommendation at this point is continue the lymphatic drainage massage. That would be good for you. And then really consider biopsy. Yeah, if you don't want to undergo biopsy, then if you follow up with a consult with me, I would assume that this is cancer and proceed with anti-cancer treatment. Yeah. Okay, but I would still advise you to go see a surgeon to have that tumor removed.
Okay. While the option is open.
Mm-hmm.
Thank you, Dr. Jansen. Sir Sean, would you like to add anything?
No, I just want to share with this particular viewer, many years ago, I also have an aversion to surgery. Let me tell you, up to today, I also have an aversion to surgery. Right? Nobody wants to go for surgery. And even Dr. Jimmy Katapia, the very talented surgeon that we work together with, he also says try to avoid surgery if you can. All right. But regardless, over the last 4 years, my view on surgery has really, really changed, right? Like for my mom, for example, she has vertigo, and then they found out that there is how shall we say, there's a swelling at the back of her brain. So she had the choice of doing a preemptive surgical procedure where they would put a tube in her head, right? So she's like a it's like a techno. She's like a cyberpunk. She actually has a flap here, all right. And they put a shunt down into somewhere in her lower intestine, something like that. And it's pretty amazing. They can actually adjust the flow of the shunt remotely. They don't ever have to cut her open again to adjust it, right? So I'm just sharing that. Of course, my mom is 74 years old. And yet, after meeting all the different doctors and talking with my siblings, and of course, my mom herself doesn't want to go for the surgery. But in the end of the day, we found out that her symptoms, her condition, if she lives long enough, she will for sure develop dementia. It is one of the confirmed causes of dementia, and it's only about a matter of time. So if my mom lives to 95, then there's a strong possibility that she will develop dementia. And it's one of those causes of dementia that you can actually stop and change. And that's why me and my sister and my brother, we all decided, we persuaded mom to go for surgery at the age of 74, right? And she went through it, everything was smooth. And she's fine right now, and everything's good. So I just want to encourage everyone that yes, don't just shut off surgery as an option simply because it's something scary and difficult. It is something scary and difficult. Nobody likes it, but even myself and for my mom and over the last few years, we've really come to understand, and there is a lot of benefit. It is really one of the most how shall we say, thorough way and complete way you can solve some of the issues, right? So again, find a great surgeon who doesn't operate on you but rather because it is the right option, all right? So I recommend Dr. Jimmy Katapia as one of them, and I'm sure you can find many great surgeons wherever you are, no matter where you're watching this from. So I just want to encourage everyone with this option, which is why Dr. Jansen made that strong recommendation. I'm sure Dr. Jansen doesn't like to go for surgery also.
Nobody wants to. Nobody wants to.
But yet, yeah, we are doing this not based on just simply because training. This is really a wise decision. But however, you need case by case basis, right? So you need to talk with your surgeon. If you find that you want to be comfortable with a surgeon who will talk more to you, then we will recommend you Dr. Jimmy. You can also consult Dr. Jansen, who will also help you interpret why the surgery is necessary and to also how you can prepare for the surgery so everything will be smooth for you. All right? Yeah.
Thank you, Sir Sean. Thank you, Dr. Jansen. All right. On a lighter note, our next question is coming from Miss Emily. The question is, can I take fish oil, vitamin C, turmeric, calcium supplement after my first chemotherapy? Or what supplement can you recommend?
Yes, of course. It's after your first chemo, so no problem with these supplements. Actually, I would even further increase the dose of your omega-3. So for cancer patients, what is recommended is 4 grams. So that's 4 soft gels per day. Yeah, so that's the right dose. Fish oil or omega-3 fatty acids have very good anti-inflammatory properties. So that would help greatly with the side effects of the chemotherapy. What other? Okay, so I'm going to tell you what I use no as my chemotherapy support supplements. So the first one would be of course Simply Nature PPARS. The other one would be a rice bran supplement named Lentin. And another one which is called AHCC. So that's made from shiitake mushrooms. Uh, so how do I decide on which to use? So the first one is if I am looking at metabolic problems, chances are you will have one. Okay. If you have any metabolic problems, then I would recommend PPARS outright because PPARS have benefits for the fixing the metabolism of the patient. No. Another nice thing about PPARS is um, it has different preparation. So you have your liquid, your powder, you have your soft gels. So peppers is actually versatile, I should say. So it can be used for different kinds of patients. So one example would be, Doc, what if I have an NGT inserted in my nose, or Doc, I am vomiting repeatedly. I cannot drink anything or swallow any tablets or capsules. So how do I go about it? We can still use PPARs. Say for example, you have an NGT, the liquid can be used to flush it down the NGT. Yeah. Say for example, you have a peg tube inserted in your tummy, so we can give liquid over there. Okay. Another example. Okay, what if you have a cancer, a condition in your head and neck? Then we can use powder for that matter. So say for example, you really hate the taste, then we can use the soft gels. It's tasteless. Yeah. So it's really versatile. Okay. So the other two, like your Lentin and your AHCC, those have immune boosting properties as well. And I've also encountered a lot of oncologists use them. So I should say they are really quite effective as well. But I usually prescribe them as second or third options if you have already underwent PPAR treatment, or you have already or if you have took PPARs already sometime in your life, or probably before I saw you, you already took PPARs. No, I also encounter such patients, especially if I get patients from who attended the forum. I won't say which forum, but it is a forum. Okay? So what else? What else? Yeah, so those are the ones that I use. Then of course food, no? Mushrooms are very good for your immune system. I always prescribe vitamin D3 as well. D3 is also very important for the immune system. Yeah, the rest of the supplements that you're taking are fine. If you're undergoing chemo, it won't interact in any way with chemotherapy. It's just that take it after 24 hours of receiving the chemo. So if your oncologist have some reservations on, you using supplements or whatever, let's just follow the oncologist. This is in respect to your doctor. And of course, you know, um, This is so that we give the right information to your oncologist. Okay, so if your onco has some reservations on that, then we just follow. We just follow. Okay, it won't harm your treatment in any way. Anyway, it's just a day or two, no, that you will skip taking these supplements, so it's fine. Okay.
Okay, Doc Jansen. Sir Sean, would you like to add anything?
Yeah, for me, of course, the one I'm most familiar with is going to be Simply Nature PPARS. And I'll let you know that PPARS, I mean, I've been doing this for the last 15 years, right? More than that. And been taking PPARS for the last 23 years. I just came back from Singapore, so I just did a trade missions with Taiwan. So I got to, so good news, Doc. I have really good news. I'm testing out now. There is a product I'm testing right now. It's actually effective for dementia.
Mm.
Wow, it's a natural
Good.
supplement. So the people have been saying, I mean the results are like people with dementia after taking it for 6 weeks, their thoughts actually clear up. This is a consistent, sorry, not that it's a cure, but it really makes a difference. So I'm very excited about that, right? So at this particular trade mission, there were about 10 different companies, and out of the 10 companies, I think 8 of them, the founders were all researchers. Most of them actually have 2 doctorates, medical doctor and TCM doctor. All right. Almost all of them are double that, right? And then they are researchers. That means they gave up, they move away from practicing medicine, both as TCM and conventional medicine, and they went into research. And they all own their own research companies, and they were coming up with new compounds and products, right? But definitely oriented towards TCM direction, as they are from this particular group. So when I saw all that, I just want to let everybody know I'm also always looking at and also being exposed to such scenarios. Simply Nature PPARS is really pretty amazing. So I remember at the dinner when we were sharing about our product, the other people who were representing other companies actually came to us to ask if we would like to work with our PPA extracts and mix it into their products because they thought it was really interesting. So I just want to share with everybody that my recommendation is, again, start with the PPARS, the liquid extract, the powder extract, right? Start because I know that it works today. Dr. Jansen, so very confident today. So start with that, then continue your journey. I'm not going to say just use Simply Nature PPARS. Continue your journey to see what else is suitable for you, but you don't waste time. Start today. It's really one of the best things out there. Yeah, just wanted to add that in.
Thank you, Sir Sean. Thank you, Dr. Jansen. Let's try to answer 2 more questions, all right, before we you say your parting words. Okay, so the first last 2 questions coming from Mr. Gaspar Monisit, this is actually coming from our YouTube, since we are simulcasting also there. So the question is, which one or which PPARS is good for rectal cancer and also a recurrence for lung metastasis?
Liquid. Liquid outright. But it has to be a combination. Always use an extract with the tablets. So liquid and the plus tablets. So now when do I consider the other extracts? I have to see you. But the factor that will largely affect the decision, no? The decision making is whether you can take it orally or not. Yeah.
Thank you, Doc. All right, shall we proceed to the last question tonight? All right. Okay, so coming from Miss Deli River. Oh, before that, I just want to greet Miss Jeanette Hu from Child House. Hi, thank you for watching us tonight. All right, the last question for tonight coming from Miss Deli. Doc, I have taken PPARS tablet for almost a year and then soft gel capsules for 1 month. I have stopped my medications for cholesterol and triglyceride while taking PPARS, but the lipid profile lab test seems to be elevated by double. And the cholesterol and triglyceride, also the SGPT and SGOT. Is it possible for PPARS to damage the liver?
No.
No, no.
It's actually a treatment no, for fatty
Yeah,
liver. I have to see you to
yeah,
investigate. So I
yeah.
cannot give you an answer right now.
Yeah, so have a consult with Doc Johnson about this. And just to confirm what Doc Johnson said is true. It is actually a treatment for liver, right? So yeah, there's no way it damages the liver, correct? And especially you are taking soft gel capsules, so the concentration isn't even super high. Yeah, I want to let everybody know that even like for myself, I've been taking Simply Nature People extracts, not just tablets, but extracts for the last 23 years, right? So Doc Johnson knows, and I think people who are on this program knows. I went to see TCM because I have hypertension, okay, and it's kind of counterintuitive. I have unlimited access to PPAR tablets, powder extract, and liquid extract. How come I can still have hypertension? So I think I just want to put it out there also, so that everybody know we on this program, Dr. Jansen, me, and everybody on this program, we are not fake. We don't hide things. Right. So when I went to see my TCM, she asked me that question that Dr. Johnson asked me also for a long time. How many hours do I sleep a day? So I sleep on average 4 to 5 hours a day only. And then my TCM says that, then she said, so she saw my blood pressure because I record my blood pressure actually twice a day. So she looked at everything. She said, okay, it's not increasing. It's stuck at about 100, average about 140. It's stuck down there. Okay, it's not increasing. So she also I take PPAR tablets, but like what I share with you guys, right? I think the PPAR tablets has given me such a good foundation. But then again, I guess I have to take responsibility that I've also abused my health that comes from the PPAR tablets and extracts. I've been sleeping 4 to 5 hours for the last 3 to 4 years, right? Almost as long as I've known Dr. Johnson. So maybe Dr. Johnson is the cause of my stress. Okay, no, just joking. Okay, but I just want to put it out there so that you guys understand, right? That PPAR protocol can make you very healthy, but if you still abuse or put your body under certain conditions, even then you have to look for additional things already. That means PPAR tablets alone will not be able to sustain. So now I'm actually on PPAR tablets on TCM, but my doctor is saying, yeah, all this combination is just holding you at 140. At the end of the day, you have to sleep. That's what she told me. At the end of the day, you have to sleep. So for this particular patient, I just want to share with you. I'm very, very confident also that apart from the the PPAR protocol that you've been taking for a year, I'm quite confident to say that you might be in an even more difficult position if you had not been taking PPAR capsules and tablets. All right, so it might have to do with the fact that your condition might require the combination of conventional drugs as well to bring it under total control and then maintain with more natural alternatives. Or Dr. Johnson might add something new, or in his consult with him, might discover another factor. Maybe you need to sleep as well, like me. All right. So I just want to encourage you, and I also want to let all our viewers know how I want to thank Sheila for choosing that question. We could have always not chosen that question, right? But we chose that question so that everybody knows and can be confident in our approach. So for this particular viewer, please have a consult with Dr. Johnson. I'm sure we will be able to better discover how to help you moving forward, right? As we say in Simply Nature, always with you from start until you achieve your healing, right? Yeah, thank you.
Sheila, you're muted.
You're muted, Sheila.
Sorry. All right. So once again, for those of you who wish to have a consult with Dr. Jansen Kalalan, just simply type in how to consult. Our caring HTS will definitely get in touch with you individually and immediately. All right. Now, I'm afraid that's all the time that we've got today. Don't worry, because for the questions that we weren't able to answer, we'll have it answered privately or ask them next week on our next week's webinar. As we wrap up this evening, we would love to hear your final thoughts for our viewers, as some of them are, of course, our viewers are a mixture of newly diagnosed in the journey or perhaps those who just actually finished the treatment for their cancer? What would you like to say to them? Who would like to start first?
Okay, I'll start first. But I'll end with giving this daily advice. No, if you're considering to see me, here's what I will do. Right now. Temporarily, stop taking everything for now. Stop taking everything. Just try to make sure you're living healthily. Eat the right foods. Drink plenty of water. Rest well. Then after a month of being off everything, we do a blood work, a lipid profile, then we talk. Okay, or yeah, wait for a month, probably 3 to 4 weeks, no, probably. Then come and see me. Then we talk. Okay, then I can request laboratories, no, so I can also assess your lifestyle. All right. So we can make sure that you are not on anything. So this is sort of a reset. Okay. So that's what I would advise for this patient. All right. So that would be for me. I'll give the floor to Sir Shyan.
So tonight was a very interesting discussion again, just like last week. And I think, yeah, all right. Okay, I'm reading the comments. So I hope, I'm actually very proud of tonight's discussion. I'm not proud in an arrogant way. I'm just glad that we stuck with our commitment with the truth, right? We don't choose questions that make us look good. We don't choose questions that we can answer thoroughly, right? We choose questions that sometimes we can't answer completely either, right? Because I guess we want to highlight to you so that as viewers of this program, you understand our character. You also understand how we go about coming to the advice that we give you. So yeah, I'm a firm believer that the truth is the best solution to everything. So in our practice at Simply Nature and on this program, Simply Healed, we do our very best to give you unbiased and as truthful an answer as we can. All right. So with that, I hope to see you guys again next week. We will have another lively discussion, other interesting insights, and of course, we hope to hear encouraging testimonies as well, right, of people doing well. And yeah, with that, have a good week ahead. I think there's in those of you who live in Philippines, next Tuesday is a newly declared public holiday. So yeah, enjoy the long, in some way, the long weekend coming. Good night, everyone.
Thank you, Sir Sean. Yeah, I just want to say that, yeah, here in Simply Nature, we actually want you to have a very good relationship with your doctors as you go along with your health journeys. All right, now on behalf of our patients and viewers tonight, thank you so much, Dr. Jansen and Sir Shyan Lim, for answering our questions. And we are looking forward to see you next week to answer more questions, all right, for our health battles. Now, for our viewers, thank you so much for joining us today. Remember that taking action in your cancer journey is a powerful step toward healing and strength. We hope that you feel empowered to make informed decisions and take control of the path forward. Now, if you or your loved one is battling any type of cancer or any health issue at all, remember that science is evolving and new treatments are emerging all the time. So keep informed and explore all available options. So don't forget to like our Facebook page, Simply Nature International, and also Dr. Jansen Calalan's Facebook page as well. Also, do subscribe to our YouTube channel. Now, this is of course to also make sure that you get updated with our latest promos and events. Now, check out our website. That's www.simplynature.ph for our ongoing website and direct promos, because you can actually get more than 280 pesos discount when you buy either PPARS powder jar or PPARS liquid extract box. Okay. Now, another one, you can actually get a free pack of soft gel capsule, which is worth 3,700 pesos. This is if you buy 6 packs of the soft gel, PPARS soft gel capsules as well. So once again, these promos are only up until March 31. So What are you waiting for? Now is the perfect time or the best time to be healthy, not only, of course, for yourself, but of course, for the whole family. So experience the benefit of PPARS at an unbeatable price. We hope to see you once again in our future webinars to come, particularly next week's episode on April 3. Wow, we are actually entering the second quarter of the year. All right, so please stay tuned as we post our next topics, because that is happening same day, Thursday, same time, every Thursday night, 7:30 p.m. So once again, thank you for watching Simply Healed webinar powered by Simply Healed Medical Group and Simply Nature International. Because your curiosity about your health conditions and your victories over cancer and metabolic diseases are what keeps us going. Because here in Simply Nature, we're always with you from start to healing. Thank you, everybody. Good night, and God bless you all.